Welcome everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Just to follow up on a question from yesterday, since the beginning of July, our tobacco and vaping enforcement officers have conducted approximately 380 inspections related to patio regulations and the wearing of masks. This includes more than 200 complaint-based inspections. As we begin the weekend, it is important to remember that public health measures continue to be the most important protection to prevent the spread of COVID-19. Stay home if you are sick, maintain a 2-meter distance from others, wash your hands often with soap and water or use an alcohol-based hand sanitizer, use proper respiratory etiquette by coughing into a tissue or your sleeve, and wear a mask when attending commercial establishments. I will now report our current case counts. There are 115,799 confirmed cases of COVID-19 in Canada, and 38,075 cases are in Ontario. Chatham-Kent has 243 cases, and Sarnia-Lambton has reported 302 cases. Michigan now has 80,887 cases, with 12,646 cases in Detroit. Today, we are reporting 2,306 cases of COVID-19 in our community, an increase of 21 cases from yesterday. 7 are workers in the agri-farm sector, 11 cases are people in the community, and 3 cases are still being investigated. We would also like to make you aware of an investigation we are conducting related to Chuck's Roadhouse on Tecumseh Road. We know that there was an employee who worked while infectious on July 24th and July 25th. We will be providing more information on this situation today once our staff have made further contact with the owner. We will be visiting the restaurant to provide direction and discuss infection control measures. Of our cases, 1,443 have now resolved. 749 people are self-isolating, and 13 people are in the hospital. 27% of our cases are between the ages of 20 and 29, 24% are between the ages of 30 and 39, and 17% are between the ages of 40 and 49. 65% are male and 34% are female, with 1% unknown. Our community has lost a total of 671 people to COVID. 49 deaths have occurred among residents in long-term care and retirement homes. There are 3 long-term care and retirement homes in COVID outbreak. In addition, there are 12 workplace outbreaks, 5 in the agriculture sector, 6 are in the manufacturing sector, and 1 is in a construction workplace. Symptoms of COVID-19 can be mild to severe. Some common symptoms include fever, a new or worsening cough, a barking cough, chills, sore throat, and shortness of breath. Call 911 if you have difficulty breathing and are struggling to breathe or speak or are experiencing severe chest pain, if you're feeling confused or losing consciousness. Please be reminded that we have 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital, Olette Campus. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. To check your results, please go to our website and click on View Your Results to access the online result test portal. If you're unable to view your results, please contact the assessment center or healthcare provider that initiated your test. The health unit will call you if you have tested positive for COVID-19. Please continue to visit our website at wechew.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. This week, Public Health Ontario launched a serosurveillance initiative in support of Ontario's COVID-19 response effort. Serosurveillance uses blood samples to determine population estimates of antibody levels for infectious diseases. This will be an important part of ongoing planning and response to COVID-19 in Ontario, as we join many other countries and areas doing this type of surveillance. Lab specimen will cross regions and will not be identifiable at the individual level. This is an important addition to our toolbox as we continue to learn and prepare our response to COVID-19 in Ontario and Windsor-Essex. For more information about surveillance study by Public Health Ontario, please visit the website www.publichealthontario.ca. I'll now turn over to our weekly epidemiological summary. Okay. So very quickly, this is what we will cover in our presentation today. Since there's a lot to go over, I will highlight the key points in each slide. The epidemic curve or epi curve help us assess the progression of the disease, whether in the community or in an outbreak situation. This particular epi curve is created to show the number of confirmed cases by the date it was reported to public health. On your vertical axis, you have number of confirmed cases, and on your horizontal axis, we have the dates these cases are reported to the public. This differs from what we usually show, which is when the case is starting to show symptoms, because we have a higher number of positives recently with no symptom. This includes all cases in the community, cases in the long-term care home and retirement home, and cases in the agricultural industry. What we can see from this graph is in the last couple of weeks, we have seen an increase in the number of cases, which was very different from what we have been noticing in the last couple of months. And in order to capture the day-to-day variation, another way to look at it is to do a 3-day moving average by reported date. The 3-day moving average should capture day-to-day variation and will try to present a much better picture of how things are in our community. We can see that roughly since 2nd to 3rd week of April, the number of cases were going down and moving in the right direction. In early weeks of May, we saw a further decline, but we are seeing increase at the beginning of June, and more recently in the last couple of weeks, we have seen a significant increase in the number of cases. This figures break down the number of cases by agri-farm sector versus non-agri-farm cases. As we can see that since beginning of mid of May, starting all the way from beginning of June and up till now, we have seen a significant surge in the number of cases in the agri-farm sector. But in the last couple of weeks, we have seen some cases that are also happening in the community. This graph looks at the cases that present to our emergency department and Windsor Regional Hospital and Erie Shores Hospital with symptoms that are related to COVID-19, such as cough, fever, pneumonia, and other. This is not an indication of any confirmed cases, just an indication of how many people are presenting to the emergency department as part of an early detection system. What we can see is we have seen some cases in the beginning of end of March, early April, and then we have seen a steady decline. But in the last week, we have seen some increase, and which is now going in the lower direction. Zoning it further in terms of the looking at the emergency department visit just as the Erie Shore Healthcare, that's where some of these cases are happening. So we have seen a spike in the last couple of weeks, which is now going down as well. This figure looks at the number of unique individuals tested per day and whether their lab results returned positive in Windsor-Essex and compared with all of the Ontario. Individuals tested multiple times on different days are counted only once in each week's count as they were tested for. In the middle of March to April, the number of individuals returning as positive was between 13% to 22%. This was higher to what we have seen in all of Ontario. Currently, as of July 25th, 4.5% of individuals in Windsor-Essex are testing positive compared to 0.6% in all of Ontario. Please note that for the most recent week, the information might not be complete due to reporting delay with the lab. Another way of looking into how we are doing is also using a 7-day moving average to look at our overall trend. The blue line indicating all of our cases using a 7-day moving average. We see a peak in late March and in April, the latter attributed to the outbreaks in long-term care home and retirement home. Currently, the agri-farm sector is driving our 7-day moving average. The green line looks at the 7-day moving average if we were to remove the workers working in the agri-farm sector. You will notice that the 7-day moving average declines dramatically from May onwards when we exclude agri-farm sectors. However, in the month of July, we've been seeing an increase in the 7-day average of cases outside of the agri-farm sector as well. We were stabilized to about 5 cases a day in May and June from community, but now we're seeing up to 15 cases per day from the community in the most recent estimates. The slides capture the week-over-week incidence rate per 100,000 population from week 18th, April 27th, to our current week, which is week 31st. We saw a dramatic increase in cases in week 26 and a second peak in week 30th, which are primarily attributed to the agri-farm sector, but we are seeing cases outside of the sector as well. Please note that week 31 is still in progress, and it will end on Sunday. This graph looks at the percentage of positive tests reported in 1 on 2 day of testing. Is basically an indicator of how quickly we are getting the test results back. As we can see, we have seen days where we are getting a lot of the cases positive cases returning back within 1 day, and most cases it is returning with more than 2 days delay. But a good number of cases we are returning is coming back to us within 48 hours of the person being tested. So from a public health perspective, a public health investigation initiated within 24 hours of reported date. Almost all of these cases in the last month, since the beginning of July, were investigation initiated within 24 hours of reported date. So now comparing ourselves, Windsor-Essex rate with the province, and what we can see is our rates are higher than the provincial average, and compared to many of the other health units as well. We have noticed significantly a higher proportion of cases in the long-term care home and retirement home, which currently stands at 14%, but at its peak it was 42%. And now we're seeing an increase in the number of individuals in the agricultural sector who are ill, that constitute almost half of our cases in the region. Breaking down our cases by each of the municipalities, what we can see is Kingsville and Leamington continues to be the highest rate per 1,000 population in any of the municipalities, whereas LaSalle and Tecumseh and Lakeshore are fairly comparable at the bottom of the case counts of COVID-19. So we've added this graph on the request of many individuals and many of the municipalities to give us a better breakdown of cases in the Windsor-Essex County. So this map displays the rate per 100,000 residents by the dissemination area. The gray color indicates no cases in the area, and it also is a function of the population density as well. As you can tell from the previous slides, in Leamington and Kingsville, the darker colors, blue and purple, indicates higher number of cases through these dissemination areas. Zooming it in Windsor, this is what it looks like by the rate per 100,000 residents. The gray area, once again, indicates no cases were identified at the time in these areas. Certain pockets had higher case rates across the city, as it's evidenced in this particular map. This figure looks at the age breakdown by percentage for each of the municipality. The green and orange yellow bar shows that there are a high number of young adults across each municipality. This is higher in Leamington and Kingsville due to the agri-farm sector, who are of the working age between 20 and 39 years of age. Tecumseh reported high proportion of older individuals, that is 80 plus, in the black bar, whereas Amherstburg reported a higher number of younger people between 0 to 19 years of age, which is seen with the dark blue bar in the graph. Here we look at the overall cases by age and sex and what that looks like in the past 2 weeks. Overall, we have seen more male cases compared to females, and this number is disproportionately higher in males within the past 2 weeks. While cases in the 20 to 39 years age group is and remains high, we're seeing higher number of cases in the 0 to 19 years of age group in the past 2 weeks. This pie chart looks at the overall cases in the Windsor-Essex by municipality. Overall, 36% of all our cases are coming from, have been from Leamington, 32% from Windsor, and 24% are from Kingsville area. Narrowing it down in the last 30 days, what we can see is 38% of our cases came from Kingsville, 30% from Leamington, and Windsor accounted for 26% of our cases, while some of the municipalities reported no cases at all. Looking at the past 7 days also tells us a different story, and what we can see is 38% of cases came from Kingsville and 34% from Leamington, whereas 24% of the cases came from Windsor. Looking at the past 7 days again, from the perspective of agri-farm workers versus some of the other workers, we're seeing more community cases, especially exposure among close contacts. And what we can see is while the majority of the cases are coming from agri-farm sectors, close to 60%, but there are cases that are coming from outside of the agri-farm sector as well in the last 7 days. Here we are looking at how these cases are acquired, have acquired COVID. We see that in earlier on it was imported to Windsor-Essex via travel. From there, we saw in March some community spread, but predominantly spread through close contacts, including contact at the long-term care home, retirement home. Close contacts are also predominantly from the agri-farm cases as well, and this is what it looks like. Within the agri-farm workers, the identified exposure is presented here. What we can see is the majority of the cases are primarily acquired through illness through close contacts because of their congregate living settings. What we are also seeing instances where the workers could not identify a possible exposure source, and that's why it's listed as the community acquired cases. Looking outside of the agri-farm sector, anyone who doesn't work in the agri-farm sector, what we can see is most of the cases are close contact. We're also seeing cases acquired through community transmission, where cases are unable to identify close contact nor being travel related. But majority of the cases that we are seeing again in this particular group is from close contact. With respect to healthcare workers, more than 3/4 of our workers, 77%, are local worker, whereas less than 25% or 23% of the workers actually travel to Michigan and were worker identified who works in Michigan. With respect to underlying health condition, majority of the individuals, or almost 75% of our cases, do not identify any underlying health conditions, while 25% or 26% of the cases are identifying chronic underlying immunocompromised condition. So looking at this graph, we like to point out the importance of symptomatic transmission versus some of the cases that are identified as asymptomatic. Majority of these cases are coming from as part of the surveillance testing from the agri-farm sector. And while we can say that most of the transmission is happening when the person was infectious, many of these individuals may have had infection in the past, which could have been resolved, but now showing as positive at the time of testing. And that's how it's presented there. Cough and fever continues to be the most dominating symptoms among everyone who's presenting with COVID symptoms. And please note that an individual can have more than one symptoms, and that's why these numbers may not add up. Looking at the hospitalization and ICU data in Windsor-Essex, what we have seen a significant decline in the number of cases in the hospital and ICU beds starting in early June, but we are seeing that it's picking up again in the last couple of weeks, where we have seen an increase in the hospitalization rates related to COVID, and also some ICU beds utilized as a result of COVID. Looking at the overall health system capacity in Windsor-Essex, the orange line highlights the occupancy rates of our acute beds. The threshold is to have the occupancy rate below 85%, which we are currently not meeting. This signals that we could be struggling to meet the needs related to COVID, and we are stretching our healthcare resources as a result of the response that is associated with COVID in a number of high cases in the region. In addition, this figure captures the overall beds available, but do not factor in the need for isolation rooms. We know COVID patients require isolation, and with limited private rooms available in the hospital, it could lead to additional stress in the acute care system capacity. The green and dark blue lines are for ICU capacity and ICU ventilator beds, respectively. For ICU capacity, we'll look at the overall ICU capacity and ventilator beds. There is no established threshold, but what we are trying to aim is to less than 50% of the capacity. Higher than this may lead to stress to the healthcare system. So in terms of the current outcomes, we can see that almost 2/3 of our cases are resolved, while we still have roughly around 1/3 of the cases that are currently self-isolating, and with roughly 0.6% or less than 1% of the individuals that are currently hospitalized or in ICU. But as we are looking at the current capacity, combined with the rest of the health system capacity, we are coming closer to the point where our health system capacity can be stretched. Among those who lost their lives to COVID, this is what it looks like. Overall, more females died with COVID diagnosis compared to males. From an age distribution perspective, almost 70% of the deaths were in individuals who were 80 years and older. The youngest person who died was a man in his 20s. Looking at our overall case fatality rate, our overall case fatality rate for Windsor-Essex is much lower than the provincial average. Windsor-Essex is standing at 3.1% compared to the provincial average of 7.1%. Focusing only on long-term care home and retirement home, our case fatality rate is 15.8%, while in the compared to the provincial average, which stands at 21.4%. Looking at the doubling time day-over-day comparison, what we can see is overall we are moving in the right direction as a country. We are seeing some positive signs in Ontario more recently. In Windsor-Essex, day-to-day over variation doubling time has dropped due to the high number of cases we have seen in the past couple of weeks. But we know that we have seen some huge fluctuation in our day-to-day comparison doubling rates due to spikes in our cases. The most recent estimated mean R0 is 0.55. This has decreased from last week when the R0 is less than 1. It means that the infection, every infection is causing less than 1 new infection, which signals a decrease in the virus activity in the community. But when the R0 is greater than 1, each existing infection is causing more than 1 new infection. Our R0 estimated varied greatly due to the influx of cases from the agri-farm sectors, and the shaded area demonstrates that the variation that we have seen. So in summary, Windsor-Essex is seeing more cases outside of the agri-farm sector in the most recent weeks. The primary source of exposure continues to be a close contact with a confirmed case. The COVID-19 related hospitalization and ICU have increased in the last 14 days and leading to some of the stressors that could that could pose some new challenges to our health system. The effective R0 value is 0.55, indicating a decrease in the transmission in Windsor-Essex, but we have seen some significant variation in the past 1.5 months. Thank you.
The conference is now muted.
We'll now take questions from the media. We'll start with AMA 100.
Dr. Ahmed, I have quite a few questions today, but obviously I'll just do the one and then the follow-up to start. When it comes to Chuck's Roadhouse, what will the investigation include?
So what we know from our investigation, and maybe Teresa can add more, what we know from our initial contact with the case is the case was working and while the case was infectious, and but taking all the right precautions, including wearing the mask and maintaining physical distancing with their employees and doing everything that they're supposed to do, which is a good sign that makes it a low-risk event. But our investigation basically will just reaffirm some of their practices, ensure that everything that they're doing continues to put the safety and well-being of the employees and anyone who is visiting the facility, that they are safe. And all I can say is, everything was, as far as we know, has been doing good. And it's not an indication or reflection on any activities or any action taken by the employer. I think they are all doing the right thing. It's just a matter of the public exposure, and we want to make sure that anyone who who may have been visited the facility at that day, most of them will be contacted directly and identified based on the register, which we know that the employers, the facility is keeping. So anyone who has visited the facility, they have their information. And we would like to make sure that everyone is aware and basically just monitor their symptoms. If people are maintaining and doing everything that they're doing, as previously indicated, they would not be identified as high-risk contact, but they will be identified as a low-risk contact, which essentially means that they may need to monitor their symptoms.
Can you share with us if this employee was a server or was he in the kitchen? Can you share those details? I'm guessing the public would want some answers on that.
All I can say is there was possible interaction with the public, and that's why we are reporting it. If there was no interaction with anyone, we may not even be reporting it.
So could this employee get charged or fined for going to work while being infected?
Not necessarily, because sometimes the symptoms, what we do is, even let's the beginning of symptom is today, we tend to go back 48 hours. So essentially that means 48 hours could have mild infection, not necessarily the person identifying. So that means that they may not even know about their symptoms. So if I start showing symptoms today, I'll have to go back 48 hours to ensure that anyone I came in contact within the last 48 hours, I will be notifying them, or I'll be identifying any high-risk exposure. So with this employee, that was the situation. At the time of symptom onset, we went 2 days back, and that's what we are reporting, that the 2 days could have been an infectious period, because that's what the public health protocols tells us. So in the last 48 hours, anyone who worked in these type of facilities, we tend to take that as high-risk contact, and as a contact, wearing the appropriate PPE, it makes it a low-risk contact, but because of the public exposure, we want to make sure that we are notifying it to the public.
Thank you.
Any questions from the Windsor Star?
Not right now, Mike. Thank you, though.
Any questions from CTV?
Yes, good morning, Dr. Ahmed. Just to extend on the Roadhouse here. So what is the status of the Roadhouse right now? I assume by your tone that they're still open?
Well, we got this notification late last night, so we will be connecting with them. Our staff will be out there today to make sure that everything is taken care of from a public health perspective. And as I said, based on our conversation, it seems like all the right steps were in place. And our employees, our staff will be out there just to ensure that they have everything that they need from an infection prevention and control practices, and then that determination will be made.
Okay. Was it a male, female? Can you tell us the age range?
No, thank you.
No? Okay. And just to clarify, I might have missed it, but did the worker catch the COVID at the Roadhouse, or was it something where they brought it to the facility?
So based on what I can see from the charts is the employee, we don't have an identified source that how this employee picked it up. But based on the fact that at the time of symptom onset, 48 hours prior, there could have been some exposure. That's why we are reporting it.
So there is somewhat of a threat to the community then, right?
Well, it would be a low risk contact, and that's exactly sometimes happens with more exposure. So again, it's not a reflection at all on the business itself. I think most of the businesses, they are taking all the precautions. It's just reiterating the same message, and to the general public as well, that when you are visiting these facilities, please take appropriate precaution. And from a workplace perspective, we're confident based on what we have heard is that they are doing everything that they should, and our inspectors will be there to further reinforce some of the messaging and some of the actions.
Okay, so I guess just for the people who are going, well, hey, I thought I was going to go there tonight. Well, how should they proceed?
Well, I guess generally speaking, in these type of facilities, if they had someone, they are more vigilant. compared to the others. So I think, and at a general precaution, I would be more concerned anywhere I go. And I wouldn't just say that this particular business will be not doing anything, that's why something happened. It's not. I think generally speaking, for businesses, facilities that have these cases, they learn from it, and then they use all the best practices to keep it safer for everyone.
Okay, thank you very much, appreciate it.
Any questions from Windsor-Essex?
Good morning. I just wanted to clarify, this employee didn't knowingly work knowing that they had COVID. It was just that they hadn't developed symptoms yet and they just happened to work prior to that?
That's correct.
Okay, thank you.
Any questions from CBC?
Yes, good morning, Dr. Ahmed. Talking about the hospital capacity, how concerned are you by seeing those higher rates right now?
Well, it's definitely a concern, and I think that's why we want to make sure that we're keeping a close eye on it, recognizing that the hospitals are also doing some of these elective surgeries as well, and some of the decision will go in scaling up or scaling down some of these activities. So they're keeping a close eye on it. We are keeping a close eye on it, and some of these conversations are ongoing. And as much as the cases that we are seeing in the community, it's very likely that we will see some impact in the acute care system, and that's what we are seeing. So hoping that we will get a good handle as a community in reducing the transmission and preventing some of these stress in the healthcare system overall, both in the acute care system as well as the increased caseload for public health.
And who would, I know you said the hospital is keeping an eye on that, but who would ultimately decide to possibly roll back on elective surgeries in our region? Would that be public health, or would that be in the hospital's purview to do?
So it would be a joint decision. Obviously, the hospital chief of staff and myself, all the chief of staffs of the hospitals in the region, we do talk, we do communicate, and some of the plans that they've made are based on the system capacity. So that conversation will happen locally first. And again, the province or someone else can make that decision anytime for us. But if it has to be a local decision, it'll be a discussion locally with all the stakeholders involved in the best interest of everyone.
Thank you so much.
Any questions from Blackburn?
Most of my questions have been asked and answered, but I do have a question about hospital capacity. In the event, should it happen, that you reach capacity, even exceed it, would cases be transferred out of the region, perhaps?
So what we know, and again, maybe the hospital would be in a better position to answer this question, but what I know that the St. Clair Sportsplex is still available to the hospital, and that can be opened up in a very short period of time to meet the need of the capacity. Obviously, it all depends on the specific needs of the individuals, and I believe with the 120 bed capacity at the Sportsplex, we still have some capacity available in the system, but the hope is we don't have to go there, because again, it does require a lot of resources to support that facility and make it operational. And we just like to see the number of cases going down and less people in the hospital and the ICU settings. But if needed, that is another option that is available to us.
If needed, the Sportsplex, or if needed, you could transfer out?
Well, I think, again, depending on the need, my first guess would be the Sportsplex. That would be the first option, unless some of the needs are very specific that cannot be met at the local hospital based on capacity, or at the Sportsplex.
Thank you.
Any further questions from AIM 800?
Dr. Ahmed, yesterday the province announced its plans for back to school in September. I just want to get your thoughts on the elementary section where 5 days a week and who knows, up to 30 kids in a classroom. Just want to get your thoughts on that.
Well, those are the discussion that we are actively having with our local school boards as well. So the school boards are really diligent in creating a plan and discussing with public health to ensure the safety of all the students. And recognizing that our children are a high-risk group, but they also need to be more active in getting their education and getting some of the other mental development that is essential for at that age group. So I think we just want to make sure that we have all the right systems in place, and our conversation with the school boards will continue to happen to ensure the safety and well-being of everyone in the region.
That plan, and I asked you this question a couple days ago, do you still feel comfortable sending your kids to school with what the province announced yesterday?
Well, as I said, I don't want to just internalize it to myself, but I think I do feel that it is important that the children should attend school. Specifically speaking, yes, I will be interested in sending my kids to school for their mental well-being and also the mental development that is essential at this age.
And sorry, one more for Teresa, Mike, if that's okay. Teresa, you talked about the complaints and going to the sites. I know a couple of weeks ago, Dr. Ahmed said maybe the education period it might have to end. Has any fines been issued yet?
We have not issued any fines, but I know that the education continues, and they do have, it's a progressive kind of enforcement, so that is what's occurring, but no fines to date.
I guess, when is it time to end the education process? Our community numbers keep on going up. Should the health unit start playing hardball with some of these businesses?
Well, what I'm reporting are the complaint-based and also our proactive inspections. So the fines or the progression of enforcement getting more severe would be repeat offenses or not adhering to the education. So as you know, there are many, many places, businesses, restaurants that are applicable to this situation. So it would have to be a repeat offense on a very specific, premise that is not adhering to the education or the requirements. And in that case, we wouldn't hesitate to move forward.
Thank you. Have a great weekend.
Any further questions from the Windsor Star?
Yes, doctor. This is the first time that you've shared a geographic breakdown of very specific neighborhoods and their relative case counts for population. I know you were hesitant to release that kind of data in the past. What can you tell us about people feeling more or less concerned about getting COVID-19 based on looking at that map?
Well, one of the biggest concerns is, as we always said, that sharing that detail is not a reflective of which neighborhood's safe or which neighborhood is worse. It's just an indicator of where these individuals are living. So someone could very well be living in Tecumseh, let's say, or Lakeshore or anywhere else, but could be working in Windsor. So their case acquisition could be anywhere, not necessarily in the municipality that they're living. So so that's one component. The other component is obviously the situation changes. Day-to-day variation could change. The graph that I showed, it's an overall graph since the beginning of this pandemic. It could change. In the beginning, it could be in one location. In the end, it could go in somewhere else. So it changes all the time, and if we make any decision or if we make any understanding based on the data that we are seeing today, it may be lead us to think or draw a conclusion which may not be accurate, and that's what we are trying to be very careful in how we are presenting that data. And I think the message continues to stay the same, that when you're out there, anywhere you are, you are susceptible to contracting COVID. You are susceptible to contacting someone who may have COVID. So you take all the precautions that you need to. Physical distancing is the most effective measure that everyone can do. And to make it even better, physical distancing combined with regular hand washing, wearing a cloth mask, these are the measures that would prevent individuals from reducing their chances of contracting COVID. So anywhere in Windsor-Essex, if you are, you are at risk, so please take appropriate precautions and do not rely just on the number of cases in each of these regions.
And about the restaurant investigation, you said more information would be released today. Do we have any sense what time that might come out?
Well, most of the information that we have shared, that's the information we like to share. The only action item is to see from our inspection report that once our inspectors are out there, if they have any different recommendation that we want to share more broadly with the public, there may be more opportunities for us to do more education with the workers. But if it doesn't change what we are talking about from a risk perspective, there may or may not be any communication back to the public in general. We do post our inspection report on our website for every restaurant in the region. So there may be more reports there, but from a public disclosure perspective, I think that's pretty much that we would share, and we've already shared the dates that people visited, and I think that's probably the information that we will share.
Okay, thank you.
Any further questions from CTV?
Yes, Dr. Ahmed. So yesterday we talked about the low German community. So with the influx of cases, I assume contract tracing is taking place. Just wondering, are all those contacts being tested?
Majority of them are tested, and again, sometimes we get some challenges in terms of identifying all the contacts, which is true for any other community as well. But majority of them are getting tested. We are engaged in conversation with the Low German speaking community, and we'll continue to do that. And we want to make sure that they have everything that they need from an access perspective, testing perspective, and getting the right support from public health. So we'll do that, and so far we are able to contact most of these individuals, and they're all self-isolating.
Okay, very good. And with the rise in COVID cases, is this being considered a community spread?
Yes, some of these cases are spreading through these community contact. But the large number of cases that we are seeing is all based on the close contacts within their families. But we like to see those numbers going down. We like to make sure that any acquisition or new acquisition of cases are going down in the community. And we like to see that number going down significantly as we are seeing in other regions of Ontario. And we wanna move forward. We want to move forward to stage 3. We want to move our community forward in the right direction, and hopefully, with the support of each and everyone in Windsor-Essex, we will be able to move forward.
Right. So is that the reason why we're not calling it an outbreak in the community then? You know, like kind of like what we did with the long-term care facilities, you know, that sort of thing?
Well, the declaring a community outbreak, I think it's we're already in the pandemic, so we know that it's spreading in the community. So if we're calling it as a community outbreak, the question would be what additional outbreak control measures that we need to put in place to prevent and limit the spread. So I think that's why the community spread can be more challenging with more closures. So all of those things are happening with limited exposure, with people staying home. So those are some of the things that we are doing. And with the sharing some of that information and details with the media and with the community yesterday and the day before in terms of how we are working with various community groups to support. It's part of that plan to educate the community, so everyone is aware, and all of us understand and recognize the severity of it, and use the right resources that is available to everyone to get tested and ensure that people are following those recommendations for self-isolation and keeping themselves safe and their families safe.
Okay, good to know. Thank you for that, and have a safe and happy weekend, sir.
Thank you.
Any further questions from Windsor?
Dr. Ahmed, you mentioned that patrons who are at Chuck's Roadhouse on the 24th and 25th would be contacted. Are restaurants required to keep a list of who's actually visited? And through inspections, have you guys seen that that's been well kept?
Well, we know that it is a requirement for all the restaurants to do that to ensure that individuals can be contact traced if they visited any facility. And again, those are some of the things that our inspectors will be looking at to ensure that the safety and accuracy of all this information that's collected. We hope that all the businesses are collecting that, and when we inspect them, we make sure that everything is happening and all the best practices are in place.
Thank you.
Any further questions from CBC?
No, excuse me, no, thank you so much.
Any further questions from Blackburn?
No, have a good weekend.
Thank you.
We'll be back on Tuesday next week. Thank you.
Thank you. Thank you.
Thank you.